Radiation is one of the 3 ways people are treated for cancer. But how does radiation work, and is it safe? We are learning more about radiation today. We welcome in Dr. Spears, a radiation oncologist with the Cancer Center of Hawaii. Hello, thank you so much for joining us.
Thank you for having me.
So, Doctor, you are a radiation oncologist. Can you explain what that means?
Well, radiation is one of the 3 ways we treat cancer patients. The other 2 are surgery and chemotherapy, which most people are more familiar with. Many people know that chemotherapy is medicine that goes into every cell in the body, where surgery is targeted to just one area. I often tell patients that radiation is more similar to surgery, except while a surgeon makes a physical opening to see and remove a tumor, we use pictures such as CAT scans to design the treatment to target just one area. So the side effects will be related to just that area as well.
Okay, and are the side effects the same for everybody?
No, it varies from person to person. There's actually a huge amount of research looking into what causes patients to have one side effect versus another. So that's still an area of intense investigation.
Okay. Now, I know when people hear the word radiation, they immediately assume it's not safe, and maybe that's why they would choose not to seek that treatment. And then I also heard, could it cause heart disease? What is your reaction to that?
Well, that's a great question, and that's been something that's happened just in the past 5 years that people have really been asking that question in depth. So yes, as we get better at treating cancer more effectively, we have to focus on making it safer, because patients ultimately are living longer with the side effects from treatment. There have been data that have shown that increased radiation dose to the heart increases your risk of coronary artery disease, heart attacks, and even death.
Okay, oh no. So are there ways to reduce that risk?
Absolutely. So the first thing I would tell patients is that the increased risk of radiation heart disease occurs when you increase your dose to the heart. And many of the older studies that we've mentioned used older methods to treat the chest that were much less targeted than our methods today. Secondly, your pre-treatment cardiac risk factors such as smoking,